The area called a sheath is inserted, and a fine catheter is threaded through this and then through the arteries into the opening of the coronary arteries. A special dye is then injected into the catheter and shows the blood flow in the coronary arteries on the X-ray. When the dye is injected, you may feel a warm sensation, but you will not feel the tubes in the blood vessels. You'll be asked to hold your breath several times while the pictures are taken. You may even see these on the screen yourself. After the procedure, the sheath will be removed from the groin or wrist and pressure will be applied to the area to stop bleeding. You will need to stay on bed rest for up to 3 hours. The catheter site, your blood pressure and pulse will be checked regularly. If you have any bleeding, pain, feel sweaty, dizzy or warm around the catheter site following the angiogram, you should call the nurse immediately. It's normal to have some bruising and tenderness around the site. A small lump may be present, but disappears over a few weeks. After looking at the X-rays, the cardiologist will then decide on the treatment for you. Sometimes more tests are needed to help plan your treatment. Results may be small narrowings, needing medication only. Larger narrowings may need an angioplasty and a stent. This is usually done at the same time. If there are several narrowings, bypass surgery or coronary artery bypass grafting may be needed. Or you may have normal coronary arteries. Angioplasty and stents may be the best treatment for you. A coronary angioplasty is done to widen a narrowed artery. The procedure is like an angiogram and usually takes another 30 to 60 minutes following the angiogram. A fine tube or catheter with a tiny balloon at the tip is passed into the coronary artery from the groin or wrist. The balloon is then inflated to flatten the plaque against the artery wall, widening it and improving the blood flow. Usually a stent, which is a fine mesh tube, is placed within the narrowed area to help keep the artery open. Following an angioplasty, you will need to remain on bed rest for a few hours and stay overnight. You'll be discharged the next day and will be seen later in clinic for follow-up. It's very important to take a special blood-thinning medication following the angioplasty to prevent clots and re-narrowing within the stent. After an angiogram and angioplasty, you should not drive for 48 hours and should not do any strenuous lifting or straining for 1 week. If you've had a heart attack, however, you'll need at least 2 weeks off driving.
As with all procedures, there is a small risk of complications. We generally say there is a 1 chance in 1,000 of a serious complication like heart attack or stroke. But we won't recommend this procedure to you unless we feel that the potential benefits outweigh the risks. Now, following the procedure, if it's done through the groin, you may have some bruising and discomfort that persists for a couple of weeks. If it's very tender at the top of the groin, then you should see your doctor. There might be a complication that we need to sort out. If the procedure is done through the wrist, you may have some bruising and discomfort, but if your arm is painful more than 2 days after the procedure, that may be a complication such as infection, and you must see your doctor.
Remember, an angioplasty is to prevent angina, allowing you to lead an active life, but it is not a cure. Improving your risk factors and following a healthy lifestyle will reduce your risk of further problems. 2 other tests are quite common. An echo is done to see how your heart muscle and heart valves are working. A scanner is passed over the heart area, taking pictures using sound waves. It doesn't show the blood flow through the blood vessels. An exercise test is done to see how your heart responds when you exercise on a treadmill. Your blood pressure and ECG are recorded while you walk. It is not a fitness test, but is helpful to assess you and plan your treatment. Coronary artery bypass grafting. After an angiogram, some people are told they will need surgery. If surgery is recommended, your doctor and nurse will discuss this with you and your family. You'll be given a booklet on heart surgery. The operation is called coronary artery bypass grafting, or bypass. Blood vessels from the chest, arm or leg are used to bypass the narrowed artery to improve blood flow to the heart muscle. These are called coronary artery bypass grafts. 2, 3 or 4 grafts are quite common. You'll probably be in hospital for 5 to 7 days following the operation and will be given advice to help you return to work and leisure activities.
That was the only good thing about it.
Surgery is very helpful for relieving symptoms. However, it is important to remember that it is not a cure, and that grafts may block up again with further fatty deposits. Reducing your risk factors and maintaining a healthy lifestyle is crucial in preserving the life of these grafts. The cardiac classes will give you support to speed your recovery and return to a healthy lifestyle. It is very important to maintain a healthy lifestyle to preserve the result of the surgery.
Medications. If you do have coronary artery disease, you'll be on medications for the rest of your life because they are proven to reduce the risk of heart attacks and increase life expectancy. It is important that you see your GP to get repeat prescriptions every 3 months before your medications run out. Some medications take time to get used to. Do not stop any medications unless the doctor tells you to. Keep a list of them with you and always take it to a doctor's visit. The reasons for medication are to reduce the clotting of blood, lowering the risk of a clot blocking a narrowed artery and causing a heart attack. Unless you're told otherwise, you should remain on low-dose aspirin for the rest of your life. Another medication is used to prevent re-narrowing after an angioplasty. To lower your cholesterol. Whatever your cholesterol level is, we know that lower is better for you. These drugs slow the buildup of plaque in the arteries, reducing further problems. To reduce the workload of the heart, by lowering the blood pressure and pulse. To help the heart recover and work better. These also lower blood pressure. Remember, all these medications are proven to increase life expectancy in coronary artery disease. If you do have coronary disease, you should be given GTN, nitrolingual spray, in case you need it. Other factors may mean you need some other heart medications. Pamphlets are available from your nurse or pharmacist with more information on cardiac medications. Please ask your nurse or doctor if you have more questions. Risk factors and lifestyle changes. A few people have no obvious risk factors, but most people have some changes they can make to lower their risk of further problems. Some things we can't change. Age. The risk of having a heart attack increases with age due to changes in blood vessel walls. Being male. Men have more heart disease than women. Women are protected by their hormones until the menopause. Family history. If you have brothers, sisters or parents under 60 with coronary artery disease, your risk is increased. Your children now have a family history of heart disease. Your family should know about their risk factors so they can make the necessary changes. Ask them to have their cholesterol and blood pressure checked. Healthy changes will benefit all your family.
I've got a girl and a boy, and they've both now been in and had been checked out with just blood tests. It's no big deal for them.
Some nationalities, Maori, Pacific Islanders and Indian people, are more likely to have heart attacks at an earlier age. Other risk factors can be modified to reduce your risk of further problems. If you're a smoker, you must stop. Smoking narrows blood vessels and increases blood pressure and heart rate, therefore increasing the workload of the heart. It damages the lining of blood vessels and makes blood clot more easily. Stopping smoking has been clearly shown to halve your risk of dying from another heart attack. You may wish to ask about nicotine replacement treatment and referral to the Smoking Cessation Service. You can contact Quitline for free support and NRT, nicotine replacement therapy.
Stopping smoking is the most important risk factor to change in order to prolong your life and reduce the risk of a future heart attack. In fact, quitting smoking is more effective than all other medical therapies combined.
We measure cholesterol by a blood test. Eating high-fat foods causes cholesterol to rise. High cholesterol levels lead to the build-up of fatty deposits in artery walls, increasing the risk of heart attack. To help lower your cholesterol and maintain a healthy weight, reduce your total fat intake by cutting fat off meat and chicken. Using low-fat dairy products such as trim milk, low-fat yogurt and cheese. Look for food labels with total fat less than 10 grams per 100 grams. Grill, bake, steam, microwave, barbecue or stir-fry your meat, fish or chicken. Increase your fiber intake by eating more fruit and vegetables, grains and cereals, and use less sugar. You will also be on medication to help lower your blood cholesterol, whatever the level is, because lower is better. Have regular blood tests and know your own cholesterol is within the advised range. Many New Zealanders have high blood pressure and don't know it. High blood pressure or hypertension makes it harder for the heart to pump blood around the body and increases the narrowing of arteries. You should have your blood pressure checked whenever you see your doctor. Reducing your salt intake, maintaining a healthy weight and regular exercise helps control blood pressure. If you're diabetic, you'll know that good control of blood sugar is very important because high levels damage the lining of blood vessels. This leads to narrowing and blockages, increasing the risk of heart disease. Maintaining a healthy weight and regular exercise help blood sugar control and reduce the complications of diabetes. If you're overweight, the heart has to work harder. Losing even a small amount of weight will help lower your blood pressure and cholesterol and improve your energy. A large waist measurement is also a risk factor. Regular exercise improves the efficiency of the heart and improves its blood supply. You should aim for 30 to 40 minutes of moderate exercise most days of the week. Choose something you enjoy. Exercise helps improve cholesterol levels, reduce blood pressure, reduce weight, and stress. Ask your doctor or nurse about a green prescription or cardiac groups in your community.
There seems to be a link between stress and coronary artery disease. People who are stressed are more likely to smoke, have higher blood pressure, to exercise less, and to eat less well. While it is not possible to completely remove stress from your life, it may be possible to reduce it or to reduce the effects it has on your lifestyle. Daily enjoyable exercise and a healthy lifestyle helps you to relax and relieve stress. Learn to recognize your own signs of stress, for example, headache and tight shoulders, and to learn ways to minimize it.
Getting on with life. The time before you can go back to work will vary depending on the size of your heart attack, your progress, and your job. Many people resume after 2 to 3 weeks. A delay of another 2 to 3 weeks may be necessary if work involves heavy physical effort. Most people can drive 2 weeks after a heart attack and 4 weeks after surgery. Some people may need longer. Passenger drivers and heavy vehicle drivers need longer and need approval by a cardiologist. Your doctor or cardiology nurse can advise you. How likely is another heart attack? The underlying problem is coronary artery disease, which we can't cure, but it can be managed. Another heart attack may occur, but a healthy lifestyle and taking medication for life will reduce the risk. Those who do have another heart attack usually recover as they did before. If you have chest pain or discomfort, you will know what to do. Use your spray as directed. If the discomfort or pain is not gone in 20 minutes after 3 doses of GTN, ring 111. Your cardiology nurse will see you to discuss your risk factors, further treatment, any concerns and guidelines for going home. You may also have an appointment with a cardiologist after discharge. You'll be given a discharge letter, including information on your follow-up appointments, together with your prescriptions when you leave hospital. Please ask your nurse if you have further questions. Sexual activity may be resumed when you and your partner feel ready. The amount of physical effort can be compared to walking about 1 kilometre or 2 flights of stairs. After surgery, any position which is comfortable is fine. Anxiety and some medications may affect your sexual interest. Discuss any concerns with your partner and your GP. Before using any drugs to improve your sexual function, it is important to talk to your doctor. Alcohol in large amounts is harmful, although small amounts may have some benefits for your health. We recommend no more than 2 standard drinks daily for women and 3 for men. Everyone should have at least 2 alcohol-free days. If you don't drink, however, we don't advise starting. You may want a green prescription to help you maintain an exercise program of your choice. There are cardiac clubs supported by the Heart Foundation in many areas, providing exercise and support.
We strongly advise that both you and your partner attend the cardiac classes. This will give you the information and support that you need. We have found that people that attend these cardiac classes are more likely to take their medicines correctly, and they're more likely to make the necessary lifestyle changes and be able to stick with them long term.
Coronary artery disease needs managing long term. A mix of the best medical treatment along with the best you can do to improve your health and fitness. Think about your own risk factors and set yourself some goals to help you reduce them. Healthy lifestyle changes need to be lifelong to reduce the risk of further cardiac events and improve your quality of life. If you've been told you have coronary artery disease, we hope you now know the best ways you can manage it. Our best wishes for your future health.